By week 35 of pregnancy, nearly 100% of pregnant women will experience some form of diastasis or abdominal separation. So, can you actually prevent diastasis during pregnancy? If you've been told that just doing the right exercises or the right program will help you completely prevent diastasis from developing during pregnancy, we need to have a little chat. Abdominal separation or a diastasis is actually kind of a normal part of pregnancy, and it's an adaptation that allows your baby and belly to grow. So in today's video, I want to talk to you about what diastasis actually is, how to test for it, and when you might be concerned, as well as things that you can do to minimize your abdominal separation during pregnancy, not 100% prevent it. First things first, diastasis, which is normally referred to as abdominal separation, is actually not a true separation of the tissue because you actually just stretch a little bit at your linea alba, which is connective tissue that runs along the front line of your abdominals. A true separation of this connective tissue would actually be a hernia. And with a hernia, you would literally feel contents from your insides pushing outwards because there's a true hole in that connective tissue. There's no hole or cutting of the connective tissue with a diastasis. It's more of just a stretching and widening of that linea alba. So the linea alba connects your two halves of your rectus abdominis muscle, that big 6 or 8 pack muscle that you normally see in the front. And during pregnancy, the linea alba has to widen and stretch as your rectus stretches, as well as all of your abdominal muscles stretch in order for your baby and belly to grow. Can you imagine if your abdominals didn't stretch during pregnancy? Where would your baby go? There would be no space. You need this stretch and adaptability of your connective tissue during pregnancy. Now, when you hear the term diastasis, many textbooks will classify a true diastasis as a widening of the linea alba greater than 2.5 centimeters, which is usually about 2 finger widths wide, and anything less than 2 centimeters is considered normal. Now, the reason why textbooks might consider less than 2 centimeters normal is because everyone actually has some form of variation in the width of their linea alba before they ever get pregnant. So you need that space and that stretching of your linea alba even before pregnancy to do things like breathe and eat and allow your belly to expand, which is everyday activities. Now, what does a diastasis mean? What does that separation actually tell you? Well, it just means that your deep core, specifically your transverse abdominis muscle, is having a harder time generating tension across midline. And so the wider and potentially deeper that separation is, the harder time your abs really just have working together to generate stability and manage your intra-abdominal pressure. Now, why does it happen during pregnancy? Well, we kind of already touched on that. If you didn't have any sort of ability for your connective tissue to expand, I don't know how it would be possible for your baby to grow. So there's a reason that your hormones during pregnancy increase ligamentous and connective tissue laxity in order for increased abdominal stretching. Research has shown that your abdominals can lengthen 100% to 150% of their resting length during pregnancy. Like I said, this is just a normal, common adaptation that is needed for the growth of your baby. Now, will the linea alba stretch greater than 2 centimeters or 2.5 centimeters in every pregnant female? Maybe not. Everything kind of depends on your genetics, how elastic your tissue is. Maybe you have a connective tissue disorder that actually means your skin and your tissues are stretchier than normal. So yeah, you might have greater stretch during pregnancy, but it doesn't necessarily mean that it's something that you can't work on postpartum. To test for diastasis recti, you're gonna start on your back in a relaxed state. You're gonna take 2 fingers and place them at your belly button, feeling for how many fingers you can get in between the 2 halves of your rectus. I can get about 2 right here. And in a relaxed state, I'm not engaging my core, just going to lift my head up off of the mat, clearing my shoulder blades and seeing how deep I can also press my fingers. I'm going to repeat this about 4 centimeters above my belly button. And I'm also going to go about 4 centimeters below. I'm also looking for how it feels. Is it soft and squishy? Is that end feel soft and squishy, or is it hard? A soft and spongy end feel might mean that you're having a hard time generating tension across that linea alba, versus a hard one usually tells us that you're doing a good job, the muscles are activating, and you're still able to provide support to your core, even though there might be a gap. Then I'm going to repeat the test with those same 2 fingers, starting at the belly button again. I'm going to exhale, and deep core remains engaged. And now I'm going to lift my head, clearing my shoulder blades, still pressing down, feeling for firmness and width. Engage the deep core, move up about 4 centimeters, test again, and then move below. So remember, it's not just about how wide your linea alba is or how wide that diastasis is. It's more importantly about the depth and the end feel, because you can have a wide gap. You can have a 3-finger width gap. I've seen this in clinic myself, but so long as you can generate tension across those muscle fibers and across midline, you still have enough core support to get through the activities that you want. So gap or width does not determine function or symptoms. The other thing that I like to do when testing for diastasis is to perform it twice. The first time, you're not engaging your deep core, you're pressing along that linea alba, looking for the width and the depth and the end feel. And then I like to have you exhale, engage the deep core, and you're lifting your shoulders and head off of the mat while then also pressing and looking for those same 3 things, the end feel, the width, and the depth, and seeing, does it get better? Does the width decrease? Does the depth decrease? And does the end feel improve? So moral of the story, if you can generate tension across midline while you are engaging your deep core, you are likely okay, even if it is wider than the textbook 2.5 or 2 centimeters. So what can you do during pregnancy to minimize the severity of diastasis so that it's easier to heal postpartum? Number 1 is just to improve awareness of how to engage your deep core and your pelvic floor by doing something that is called hugging the baby, which is where you exhale, you blow out the pursed lips, and you zip up your core from the pubic bone all the way up to the base of your ribs. And by properly hugging your baby, you're engaging that deep core, that transverse abdominis muscle, and you're providing more stability to your core to prevent that excessive stretching at the linea alba. The second thing that you can do is you can adjust your posture and position. If you are standing and you are allowing your belly to spill forward 24/7. Maybe you've got a job that requires you to be on your feet all day long and your belly just naturally starts to spill forward. You tip into that anterior pelvic tilt. It's going to place a lot of stress at the midline of your linea alba. So working on improving your posture by standing more upright. I love the cue of imagining someone's pulling you with a string up towards the ceiling to help you get the ribs stacked over the pelvis is going to help tremendously just in your day-to-day posture in preventing excessive stress and outward pressure at your linea alba. The third thing that you can do is change or modify the exercise. No one will know if you go from a full front plank in the first trimester to an incline plank in the third trimester, or to a plank on your knees in the third trimester. Modification is okay to perform during pregnancy, and it's expected. So if you start to see what is called coning or doming at the midline of your linea alba, which is basically a protrusion at the midline, almost like a tent-like appearance, that's a sign that you're not properly managing your intra-abdominal pressure, and you might be I don't want to say damaging, but you might be stretching the linea alba a little bit more than it needs to. So coning is kind of a sign of, hey, pressure management is not under control right now. Let's go ahead and modify the exercise. And if you have absolutely no idea what I'm talking about when I say coning or doming, check out the more in-depth video I did all about coning during pregnancy with more visuals about what that looks like and why you should care. And the fourth and final thing that you can do to kind of minimize that diastasis during pregnancy is to decrease the volume or load that you are lifting during pregnancy, especially towards the end. Now, I'm not saying you need to stop strength training during pregnancy. I obviously am a huge proponent of strength training and staying active during pregnancy, but we're not necessarily trying to hit PRs at 39 weeks of pregnancy. So if you are starting to notice a ton of coning towards the end of your pregnancy while lifting those heavier loads, maybe just take it down a notch, and you'll notice that you're able to breathe better through the exercise and better support your core. Remember, it's about being intentional now so we can get back to intensity later. You have a lifetime to work out in a more intense fashion after having your baby. So a 3-month decrease in load or volume is just a drop in the bucket of your lifetime of strength activities. If you want a guided strength training program that teaches you how to properly manage your pressure and modify exercises as needed, then you've come to the right place, because my Movement Through Pregnancy program teaches you how to do all of that and more with fully guided strength training workout videos for every single week of your pregnancy. I will include a link to it in the description below.